Namaste, Dr.Remya Krishnan here. Recently, I happened to see a video yesterday, Beer Biceps channel of YouTube, where I was listening to a talk between Dr. Phillip and the interviewer regarding the scientificity, the matter of scientificity of Ayurveda. So I was listening patiently because healthy criticism means when we want to criticize something, a medical science or whatever it be, even a piece of work or art or science or literature, whatever it be, we should have first of all receptivity. We should be knowing, we should be honestly and patiently and working hard to know the exact picture of that particular thing which we are criticizing. Whatever we want to criticize something, we should be studying it first. In my point of view, if I want to criticize something, I should be studying it seriously. I should be trying to understand the real essence of what I am criticizing about. Otherwise, any criticism is waste of time. So whatever I am doing in this video is not merely based on a superficial outline story. I have studied deeply his understanding, his perception about Ayurvedic science and what he is carrying in his mind regarding Ayurveda. I have been studying this deeply. This started not from yesterday. I have been observing him in many videos, but initially I just neglected because this person knows nothing about Ayurveda and he's just talking something. But later on, many people are sending me videos of this doctor. So I thought let me hear him, what he is talking about, and let me try to make the people understand what the facts are, based on which I have come on this video. So in that order of same order where he is criticizing Ayurveda, it is, I have observed in Beer Biceps channel, he had started commenting on jaundice, maybe his specialty, liver disease, jaundice. So what he is telling in Ayurveda, jaundice, Ayurveda doctors are treating jaundice like with some herbs. Like in allopathy, what they are looking for is cause of jaundice. I'm not going into the analysis of that, but let me tell you, we are learning Western medicine, all the subjects except biochemistry. So the nature of disease, what kind of cause mechanisms are behind the disease in the eyes of modern medicine, in the perspective of Ayurveda, what we are analyzing simultaneously side by side. So in liver disease, for example, jaundice. Jaundice is mentioned as an independent disease in Ayurveda and not a symptom. Jaundice, according to Western medicine, is just a symptom, but in Ayurveda, it is a disease. What he thinks is that Ayurveda is treating jaundice like a tribal medicine, what tribal healers are doing. I think he is getting such a picture from many conventional Ayurveda, qualified Ayurveda practices, I think. But being an SBEBA, pioneer of SBEBA and a practitioner and faculty of science-based, evidence-based Ayurveda, which we have pioneered by long, deep study of Ayurvedic science-based medicine, I will tell you, Dr. Phillip, this is for your understanding. We all are analyzing SBEBA practitioners who are trained by us. Also, they are analyzing very deep-rootedly the cause mechanisms of jaundice because Ayurvedic science clearly mentions to treat the cause mechanisms and not the symptoms. I think you have got a mistake there. You think that Ayurveda treats symptoms. It is not like that. Even though you were telling that Ayurveda doctors are telling that we are treating root causes, but we are not doing so. I don't know what makes you feel so, but we are treating, SBEBA practitioners are treating the real cause mechanisms. There are highly specific algorithms, Ayurvedic science-led algorithms to understand jaundice. in the particular patient. Okay, in that particular patient, what cause mechanisms have led to jaundice, whether it is infective cause, whether it is autoimmune cause, whether it is some other cause like cirrhosis or cancer or some toxicity induced, alcohol induced, whatever mechanism has happened. And finally, if it is by hepatitis, inflammation of liver has happened. So you may think that inflammation, what do Ayurvedic science speak about inflammation? If you don't know something, that doesn't mean that Ayurveda doesn't speak anything about inflammation, infection, etc., autoimmunity, etc. In SBEBA, there are clear-cut definitions for what is infection, what is inflammation, what is autoimmunity, what are the cause mechanisms for each of this. So if it is an infective jaundice, there are treatment, diagnostic and treatment principles for infective jaundice. Whether it is hepatitis A or B, we are employing modern diagnostic tools and algorithms, essential lab tests. We can understand whether it is infective jaundice, inflammation has happened to liver or not. We are checking for inflammatory parameters. We are checking for inflammatory clinical picture in the patient in detail. There are clinical parameters for inflammation mentioned in Ayurvedic science. For your awareness, Dr. Phillip, I am speaking about mainly. So we are not giving like one herbal antidote or one herbal formulation blindly to treat jaundice. If it is infective jaundice, especially hepatitis A, it is naturally resolving infection. In modern medicine, they don't have any treatment, even though they are giving antiviral, so-called antiviral drugs. Let me tell you, antiviral doesn't mean anti-infective. Viral replication is being arrested. Their infection is immune response to viral infection. For your clarification and for the clarification of audience, I am telling, antiviral drugs, if you are consuming in viral infection, you should be knowing that infection is not bite of virus. Infection is a healthy immune response against a pathogen. So where the intervention is required in the immune system to facilitate immune system to eradicate the pathogen and stabilize healthy immune system. This is the mechanism explained in viral infections in Ayurveda, and this is very much streamlined, and it is trained and taught and educated to SBEBA practitioners. So we know how to treat viral jaundice with protocols, medicational and non-medicational protocols. We can eradicate virus easier and faster than Western medicine because it is taking some days with all the discomfort still present. That's why you are giving different medications. If fever is there, paracetamol. Dr. Abhi is telling you are not treating symptoms. But I am seeing in all mechanisms you are not treating for the disease. For example, in this cirrhosis, what you are doing? Cirrhosis, you are giving medication for portal hypertension. It's a complication of cirrhosis. Cirrhosis might be happening by liver inflammation, which can happen by alcohol, which can happen by chronic infection, which can happen by autoimmune mechanisms, which can happen by cancer. But you are giving the drug approach in cirrhosis. Just when you look upon, you will understand that you are giving beta blockers. Beta blockers are not meant to reverse cirrhosis, but they are meant to prevent the complication of cirrhosis when blood is pooling up in portal veins, because cirrhosis can cause increased pressure in portal vein, and pooling up of blood can happen in the esophagus, causing the veins to distend, and bleeding can happen. All these are happening if the liver function is not getting corrected during cirrhosis. First and foremost thing in cirrhosis is reversing inflammation, immediately rectifying the hepatic circulation so that complications do not happen. But Western medicine protocols are beta blockers, artificially trying to prevent portal hypertension. But I am seeing many patients, Dr. Phillip. I am treating liver disease. I am finding many patients who are on beta blockers This 3 days before also, 1 week before also, I have seen an elderly woman who is having abnormal liver function and all the evidence of risk of portal hypertension in her ultrasound while she is undergoing all these protocols, beta blockers, and you are giving antibiotics in hepatitis. Hepatitis is a viral infection, but protocols mention IV antibiotics. I don't know what is the logic. Maybe you are giving for, if it is progressing to bacterial, maybe you are giving. I don't know, but infection is an immune response. It is not bite of virus or bacteria. Anyway, you are giving low protein diet. You are giving supportive care in liver disease. You don't have anything to reverse inflammation other than immune suppressants or to prevent complications like beta blockers, then what is antibiotics or diuretics or all such supportive adjustments you are doing. And you are criticizing a medical science, the approach of which is unknown to you. We are having systematic SBEBA, science-based, evidence-based Ayurveda is having very systematic, highly specific protocols to diagnose the cause mechanisms of liver disease, jaundice. You are giving, in jaundice, you are giving antihistamines to suppress itching. You know the cause of itching lies in liver, but you are giving suppressants for itching, and you are claiming that you have scientific cure for all these conditions, whereas Ayurveda doesn't have. That is only because you are ignorant of the scientific facts of Ayurveda. So I just want you to know that it is possible to treat hepatic jaundice with scientific Ayurveda. Last week I got a patient whom I was mentioning about. She had very low platelets. She had anemia. She was having liver disease for nearly 1 year. She was on your protocol. Your protocol in the means Western medicine protocol. She was having beta blocker. Despite of that, she was having anemia. Her liver function was abnormal, evident through the liver function test, and she was also having some other problems, health issues. That is why she came to me. Now after 1 week of first stage and second stage addressing the immune system, now she is having her HB is improved, her platelets are improved, her liver function is normal and stable. So understand, this is not experience. Experience and science are different. I will come to that anyway. So just understand that jaundice has accurate, highly precise diagnostic and treatment guidelines in Ayurvedic science. Okay, so with that I am starting. He is telling scientific methodology, scientific research. Ayurveda is pseudoscience. Real medical science have scientific method, etc., which begins from drug discovery. So what Dr. Phillip thinks that the medical systems which are undergoing drug discovery are scientific systems. That is purely illogical, Dr. Phillip. Drug discovery. Why you are doing drug discovery? Because you don't have treatments or the existing treatments are not proving enough to save the patient. That is why you are doing drug discovery. New drug discovery. How do you start drug discovery? With an unknown compound you start. You are telling that you are starting with molecules. You are conducting phase after phase trials. There are 5 phase trials. Anyway, it is an unknown compound, right? You are starting your drug discovery from an unknown compound. And you think that Ayurveda is also like your SIMS textbook. What is your SIMS textbook? Current Index of Medical Specialties. Therapeutic formulary explaining newly emerging medical formulations. That is what SIMS textbook is. You think that Ayurveda is also a SIMS textbook. You are telling that you have seen our ancient scientific treatises. Have you read any chapter which starts with this medicine in that disease? There are, I don't know whether you know, in all our Samhitas, which are authentic medical, scientific medical treatises, which explain basic and applied research evidences, inbuilt evidences in the books. where no, you can take any one chapter. You can take Jwara, first chapter. You can take Jwara. Are you seeing the names of formulations in the beginning? Are you able to see? I don't know whether you know Sanskrit. You take the help of an Ayurveda doctor and ask, are the medicines explained first in any chapter? Treatment. It is not like that. It is not like that. For your understanding, Ayurveda explains every disease in the patient. In the patient. We don't have disease outside the patient. We study all the diseases inside the patient, in the particular internal environment. So every disease, ancient scientists have asked us to understand the nature of the disease, the nature of cause mechanisms particular to that disease in the particular patient, and the signs and symptoms general to that disease and specific to the particular causes, intrinsic causes of the disease. You don't have intrinsic causes. You are caring only for the extrinsic causes in Western medicine, germs or alcohol, or I am coming back to liver only because you address yourself as liver doctor. I don't know. So that's why I am quoting liver more. So you are considering extrinsic causes. For us, equally important are the intrinsic causes. We are always surrounded by different causes, but always we are not getting sick. So what makes us sick is what is inside our body that is determining. So we have many intrinsic causes which are explained systematically. So we have to study the intrinsic cause mechanisms based on which we have to we have to examine the disease. There are certain parameters to examine the disease, to comprehend the disease. There are certain parameters to examine the patient, to understand the patient. There are certain parameters to examine the treatment, to understand the treatment. You know, there are 3 steps to decide a treatment in Ayurveda. It's not like this medicine in that disease. It's not like unknown compound after undergoing different trials in animals, in isolated tissues, animals, and double-blinded randomized control trials, counting benefit risk in temporary population for temporary period and approving benefits outweighing risk drugs, which are always influenced by vested interests as some drugs, approved drugs. That is not our method. It is a human science. Dr. Phillip. Ayurveda is a science of human being. We cannot take any risk. For you, you are studying the drugs. For us, we are studying human beings. We cannot play with human beings. We can do treatment only once we are confirmed of what we are doing, what logics we are applying, in the patient to understand the disease, to understand the cause mechanisms active in the disease, to understand the patient environment, to understand the treatment. Treatment is not drug, Dr. Phillip. In Ayurveda, treatment is not drug. Treatment means the logics. Okay? There are many logics, diagnostic and treatment principles. Don't think that there is no research in Ayurveda. Ayurveda says, Pariksha karino kushalo bhavanti. One who does research will only become proficient in medical practice also. So he must be doing research throughout his life. And what kind of research he should be doing? The objective of research is termed as pratipatti in Ayurveda. And the objective of research is to understand highly precise mechanisms to heal the patient. Heal the patient. In Ayurveda, unlike Western medicine, we are not giving treatment to produce benefit risk, uncertainty-led benefit risk. Dr. Phillip, we are doing treatment to heal the patient. Okay, it's mentioned, our definition for Bheshaja is Tadhaiva Yuktam Bheshajyam Yad Arogyaya Kalpade, not Benefitaya Kalpade. We have a very big responsibility. Health will follow only healing. Doing adjustments will not produce health. Health is always followed by healing, natural healing. by body's own innate mechanisms. So there are highly specific algorithms which a scientific Ayurveda practitioner must learn in the science of diagnosis and science of treatment of Ayurveda, by means of which we can pinpointedly work on the targets, multiple targets active in the patient responsible for his morbidity, and heal, reverse the cause mechanisms, which we have resorted in SBEBA. So it is like science-based medicine. Modern medicine is unknown compound-led, data-led, uncertainty-led, trial and error research. In Ayurveda, research should begin from science. Science of Ayurveda. Pratyakshadhoja yadrishtam, shastra drishtam cha yad bhaved. Samasadastadubhayam bhuyotjnana vivardhanam. How to enhance the knowledge of accuracy of diagnosis and treatment. Pratyakshadhoja yadrishtam, what you examine, what you understand in the patient is very limited. And shastra drishtam cha yad bhaved. You have to understand led by the observations in the patient, every individual patient, as well as you have to understand from the science. Shastra drishtam, science of Ayurveda. What is explained in the science regarding how to understand a disease, a patient, his state and stages, everything you should be appraising. And samasadastadubhayam. You have to combine what you have understood from the science with what you have understood from the patient and do rational treatment. Rational diagnosis and rational treatment. That is why Ayurveda research doesn't start from an unknown compound. Research starts from known science. It is a deterministic science, not a probabilistic, drug-oriented, data-oriented, unknown compound-oriented, trial and error-oriented, so-called science. Western medicine is like that. Whatever physiology, anatomy, pathophysiology, pharmacology they are having, finally what is counted is the data of benefit risk with an unknown compound. Whether this compound produces more benefit risk than the previous one, or intervention produces more benefit risk than the previous one. That is what they are checking for. But in Ayurveda, there are two kinds of evidences. Dr. Phillip. In Ayurveda, let me tell you, if you are patient, you should be listening. There are two kinds of evidences. First evidence is science-based evidence. Don't go again to that science, what you are speaking about, starting from unknown compound, trial and error science. Just leave it for some time apart and listen to me. This is what I am talking about. Science here is scientia, knowledge, deterministic science. It is comprising of siddhantas. You are talking about the Tridosha, no? So Tridosha Siddhanta. It is not theory. Okay, theorem. What is the difference? Theory can go change, keep changing. When a different contradictory observation comes, theories keep changing. It is based on inductive reasoning. Theorems means siddhanta, parikshagir, bahuvidam parikshya, hedubhir sadhayitva, sthapyade nirnayaha. Like mathematics and physics. Determinism, parikshagir, bahuvidam. The theorems which are explained in Ayurveda are experimented by multiple scientists in multiple ways for long period, such a long period. You know how many years old Ayurveda is. So it has been multiple tested, verified for many centuries. Bahuvidam parikshya, multiple methods. Hedubir sadhaitva. What is tested? It is not unknown compound led benefit risk that is tested. Logics are tested. Whether this principle applies in this situation, yield this result. So cause, mechanism, effect is relationship is tested, verified and established in theorems. So we have in Ayurveda, we have only theorems and tattvas. Tattvas means principles. We have diagnostic principles, rational standards for a diagnosis. And I told you, diagnosis of disease in the patient. We have diagnosis of patient, disease, and we should be experimenting, or we should be evaluating treatment also. Treatment principles also before deciding the treatment. So you think that, so that makes lot of difference. So first evidence is science-based evidence. Every physician must know how to appraise science-based evidence. But Dr. Phillip, I agree with you, conventional Ayurveda practices are so horribly illogical, and that is why you are getting this distorted picture of Ayurveda. Any conventional Ayurveda practitioner, that is not their fault. That is only because of faulty education. That is because of the faulty education. The rational standards within the science of Ayurveda are not known, recognized, established. I agree with you completely. We are just deviating from the rational standards within the science and doing something observation-led. Because Ayurveda community is nowadays compelled to mimic what Western medicine is doing. Dr. Phillip, what to say? Ayurveda community itself is not aware of innate scientificity and potential of Ayurveda. That is why SBEBA is emerged. Okay, so in SBEBA we are doing science-based evidence. All the doctors are trained to appraise science-based evidence to make sure that what they are diagnosing is uniformly correct. We can explain, transparent. Every doctor can explain how they are diagnosing the particular case. There is a uniform method of rational standards. Shastra Sahita Tarko Sadhananam. That is the golden standard of evidence-based medicine in Ayurveda. Shastra Sahita Tarka. Science-led reasoning. Inbuilt standards in the science are to be employed to verify and confirm the diagnosis, accuracy of the diagnosis of disease, cause mechanisms, state and stage, and patient. That is what is called primary evidence. Now, secondary evidence is what is observed in every patient. When we are applying the primary evidence correctly, we can understand what is happening in the patient. So, the observations in every patient matter. It's not trial and error, Dr. Phillip. We cannot give an unknown compound with blindedly. We are giving some compounds and looking for benefit risk of the compounds. It is so illogical, no? Because several factors can impact every individual patient. Patient environment is highly complex and variable. It's not one molecule alone that is causing an impact in a disease process, Dr. Phillip. There are multiple factors. What all diseases he was having, what is the history of his morbidity, what exactly had led him to this particular disease, where you are giving a molecule to block, mask, or suppress. Anyway, the molecule is not meant to reverse the disease. In modern research, all the molecules are given to block, mask, suppress immune system, enzymes, pathways, or supplement artificially with hormones. It's not meant to improve the immune functioning, efficiency of the immune system, or abnormality of immune system, or reverse inflammation. Nothing like that. So anyway, whatever I'm telling is, it's a highly reductionist method of research, what you are doing, led by inductive reasoning. But for us, every patient counts. We cannot neglect some patients, focus on some patients, and count, wow, in 10 patients, 7 patients show benefits. Next moment, what is happening, who knows? We cannot know with RCT trials. After the study stops, next month some person is getting complications. Who will know? Who is responsible for that? So that is unscientific research in Ayurveda. We are starting with science. That is why Acharya told, Pratyakshadocha yadrishtam. Pratyaksha means in patient, what you are observing. Shastra drishtam, what you have learned, understood in science. You have to apply first. Knowingly, you have to start research. That is my final point. You should not start research without knowing anything. You should be knowing what you are doing, how, what, when, where. Logical approach. If there is any logical science handling human being in status of disease, it is Ayurvedic science. Because all the methods, rational algorithms to understand disease, patient, state and stages, treatment, everything is explained in Ayurvedic science. So there, and you are telling active principles. How do you know a medicine is working? Ashwagandha is given to many people. Ashwagandha has reduced stress to some patients. That is not scientific. I agree with you. It is not scientific. And Ayurveda doesn't advocate to give ashwagandha, brahmi, amalaki, gooseberry or anything to people blindly. Dr. Phillip, we have science-based medicine. We are treating for the pathogenesis. We are not treating for symptoms. We are treating the patient. Sometimes multi-tangled pathologies, not one disease alone. When we are treating for viral fever, if he is a liver patient, his liver parameters also improve. For your understanding, Dr. Phillip, I'm not telling, now you may ask me where is the peer review, where is other things, etc. That is next level. I'll tell you now, when we are treating a patient for viral fever, who is under your treatment for liver disease, perhaps, we will ask you, he will come to me and tell, please, I am having viral fever, please treat me. First question, I will be checking all the blood parameters, I will be taking a detailed history, I will understand that he is on liver disease, he is undergoing all this, perhaps beta blocker or antibiotic or whatever it be, whatever you are doing, all these adjustments. I will be telling this patient honestly, honest doctor I am. So based on my science, there is no mechanism to treat for viral fever by abandoning liver dysfunction. So when I am treating viral fever, I should make sure that your liver function should also improve and nothing should interrupt the process what I am doing. So only if you are willing to stop other medications, I am able to treat you and heal you. My intention is to maximum, I am estimating with the prognostic standards explained in my science, how much it is possible to heal you. My purpose is not doing adjustment. When I am making sure your immune system is healing yourself, I am healing viral fever not by antivirals. I am treating viral fever by facilitating or improving the efficiency of innate immune system to eliminate the virus. That is how I am doing in SBEBA. So with that method, liver function will improve. Dr. Phillip, if you have learned physiology and pathophysiology, you will be able to understand what I am speaking. Human body is not a machine, no. Primarily it looks simple, but secondarily it's highly complicated. You have to understand the entire picture. It's like Albert Einstein told, no, when scientists are looking at many trees, but they are unable to see the entire forest. It's wrong. We have to see the entire forest and do the needful in the intended places. So what you are telling is active principle. Ashwagandha active principle is to be isolated, studied, and it should be undergo all these rigorous trials, phases, trials as per your scientific method. Your scientific method is testing unknown compound and not the patient, not the disease, not the healing process. I repeat, your scientific process, which you are always boasting, you are boasting a lot about your scientific process. There is no wonder because that is the hallmark of your scientificity. I agree with you in your point. But the thing is that the so-called scientific method which employs biostatistics is not studying the patient. It is not studying the disease process. It is not studying the state and stages of the disease process. It is not studying the state and stage of the patient. It is not studying the mechanisms of healing. The so-called scientific method, which you consider as hallmark of scientificity of medicine. What is the purpose of medicine? Medicine is meant to heal, no. Dr. Phillip. Medicine is not meant to do adjustments. Who wants to know whether your drug has over benefits and less risk? You tell your patient honestly, this drug has more benefit and less risk. Your patient is asking, doctor, I am having cirrhosis. Will it be healed? No, it won't be healed. It will protect you, you are telling. Cirrhosis cannot be reversed. But it will protect you, you are telling. How does it protect you, doctor? Be honest to yourself. You are giving beta blockers. In hepatitis, you are giving antiviral drugs. But I am seeing lots of patients. Still, liver dysfunction is very high. I have seen many autoimmune hepatitis cases. I have treated and helped them to reach at a point where their liver function is normal. They don't need any medicine. They are leading a normal, healthy life without any medication, with SBEBA. So, when you are telling what patient is expecting from you is not a proven drug, Dr. Phillip. He will not get anything by using a proven drug, no. Proven for benefit risk in this much population. Why they are coming to you? They are coming to you with the hope that they can heal. They are coming to you with the hope that they can avoid liver transplant surgery. They are coming to you with the hope that one day they can lead a normal, healthy life by avoiding the necessity of expensive drugs and interventions in future. How much you are able to do justice to those patients who are coming to you. Instead of studying Ayurveda, how herbal toxicity, it's your cup of tea. I am not interfering in your matters, but this is my humble suggestion to you. Instead of counting, you don't know anything about Ayurveda. You're just blindly criticizing Ayurveda. So instead of doing blind criticism of Ayurveda, you try to honestly look inward. How much justice you are able to render to each and every patient who is coming to you. Are you able to take them out of a medicine, out of need of medications in liver disease? I'm not asking about the viral infection, okay? Liver infection, that will subside automatically. Hepatitis A like viral infections. I'm asking about autoimmune hepatitis, cirrhosis, and other conditions. Cancer of the liver perhaps. More serious stage, people are coming. It requires liver transplant. Let us consider alcoholic cirrhosis, non-alcoholic cirrhosis, fatty liver, autoimmune hepatitis. Are you able to take the patient out of the necessity of medication? Are you able to make them healthy? Healthy means the physical parameters of health and biochemical parameters of health. We are looking both. Not like, are you healthy? Patient will feel, yeah, I am healthy. I am feeling healthy. That is not our health, okay? So here it is, you are telling that it is anecdotal experience. Ayurveda is anecdotal experience. I don't know, Ayurveda is science-based medicine. What makes you feel so? Your ignorance makes you feel so. Ayurveda says, Shastra Sahita Tarko Sadhananam. Ayurveda says, Vina Tarkena Ya Siddhi, Yadrcha Siddhi Revacha. Without inbuilt scientific reasoning, without employing the innate rational standards of science of Ayurveda in your diagnosis and treatment, if you are giving some medicine blindly and if you are getting some results and claiming it as scientific cure, it is foolish. Ayurveda is telling, Vina Tarkena, without scientific reasoning, Ya Siddhi, if you are getting benefits, Yadrucha Siddhi Revacha, that is just a spontaneous cure. That should not be done. Scientific practitioner of Ayurveda should do scientific reasoning with innate rational standards of the science. And our medications are not working by active principles. Dr. Phillip, if you isolate active molecules from our medications and study them isolated setting, the moment you are extracting them from outside the medicine, it becomes different things, Dr. Phillip. Our medicine is not a cocktail of different active principles. It's a medicine, Dr. Phillip. There are documented basic research evidences. You are thinking that it's so blindly written, all these medicine names. It's not blindly written. Every medicine in Ayurveda has inbuilt scientific reasoning for the specific cause mechanisms where it should be employed. You got my point? It's not like liver disease, these medicines, kidney disease, these medicines, fever, these medicines, not like that. Every medicine documented in the science of Ayurveda has inbuilt evidences of what kind of pathology it is meant to be used, what kind of patient it is meant to be used. So precisely documented in the science. You are not able to see all that because you don't know anything, no. I am ready to forgive you, Dr. Phillip, for your ignorance of Ayurveda. But when you are commenting on Ayurveda, understand that Ayurvedic medicines are not unknown compounds. I don't know about the patent medications. Nowadays, so many strange medications are being emerging with patency in Ayurveda. I cannot say that they are scientific medicines. There are many flaws for these patent medications. I am talking about classical medications. Classical medicines documented in Ayurveda have inbuilt scientific proof of how to understand, how to verify, how to apply, how to evaluate, and how to avoid the adulteration. What can be done if one ingredient is lacking? Are there any substitute medicines? Everything, quality control parameters, everything is explained in Ayurvedic science. And quality control parameters nowadays for Ayurvedic formulations, there are very good manufacturing companies who are adopting all these quality control parameters. For classical medicines, we are prescribing for the patients. So Dr. Phillip thinks that some herbs are being prescribed, active molecules are working. It's not active molecules. There are highly specific, precise principles of pharmacodynamics and kinetics explained in Ayurveda. In Ayurveda, a medicine works by interaction, biological interaction with the subject. A medicine will work only in the subject, human subject. Biological interaction is happening starting from mouth. Throughout every cell of the body, biological interaction is happening between the medicine and every molecule of the medicine and the cells. So it is not active principle. Medicine is working. That medicine is a scientific formulation which has its own science of knowledge of how to use, where to use, when to use, what all precautions are to be taken care of regarding the disease, regarding the patient, regarding the state and stages of the disease and the patient, regarding the medication. So specific, Dr. Phillip. Your lifespan will not be enough to study all these. If you are honestly caring to do research in Ayurveda, I am welcoming you. But you will need to join for BAMS. No other way. You should start from the fundamental principles of Ayurveda. We have fundamental principles in drug application. Our evidence-based medicine is science-based, Dr. Phillip. Science means what? Not testing. Science means scientia, knowledge, determinism. Knowledge of determinism, which explains cause-effect relationship, which adopts deductive reasoning. Okay? So I think I have covered all the points. So evidence of healing. So Dr. Phillip, do you have evidence of healing for any treatment or medicine? Surgery, let us keep apart. Surgery, you have adopted basic principles from Susruta Samhita. And surgery is a skill. I do respect the advanced technology in surgery and advanced technology in diagnosis, which any medical system can adopt. It's not like only meant for the Western medicine. It's nothing like that. Diagnostic technology, diagnostic aids, surgical techniques, all these are very much appreciable. Coming to medicine, I'm asking Dr. Phillip, can you explain, starting from fever, are you having any healing methods in fever? Healing in the sense, don't tell me antiviral, antibacterial, antihypertensive, thyroid supplementation, anti-cholesterol. Everything is anti, no. Our science is different. We are always for human body, for healing, for health, for healthy long lifespan. Whatever we are doing with regard to prevention or cure is for the patient, for his healing and fastest healing and stabilization of health. So you are telling about appeal for antiquity. Okay, so appeal for antiquity. There are many antique pieces in the museum. So if you want to bring it forward, you have to do research. But we have to do research. We are doing research in science-based, evidence-based Ayurveda. What you are finding in conventional Ayurveda practices, unfortunately, are wrong in Ayurveda, flawed. Because they are following your methods, Dr. Phillip. They are striving hard to get acknowledgement. You are telling no, all these 14 years, Ministry of Ayush was striving to, but no, nothing is clinically approved. Why it is happening? Because it is not researched as science-based medicine intended to be. There are innate scientific research methodologies explained in the science of Ayurveda. Okay, so for your knowledge, that is to be adopted to understand and scientifically apply Ayurveda. So that's all, Dr. Phillip. I will answer all these questions what the public is having after I close this, because I am also running out of time. This is in between my OPD. I have come on live. Thank you for your patient hearing, and please do share my video. Also, the more you want to know, I will give you a YouTube link under this, in this comment section, explaining the scientificity of Ayurvedic science. That also, please, my videos, my posts and all my videos are SBEBA videos, are open to all of you. You don't need to take any permission or consent to share with humanity, for humanity. Namaste.